Bismillahirrahmanirrahim. Today we are going to talking about pulmonary infection. The infection in the lungs which are caused by some bacteria, virus and fungus. Different disorders which is known as pneumonia, tuberculosis. Due to pneumonia, there is 1/6% death in the United States. It is responsible. I want to explain you what's the mechanism of infection in the lungs. Here in the lungs, sacs. In the sacs, when fluid filled due to inflammation, this is known as pneumonia, guys, which is most common disorder in the world. I want to explain you here. This is our lungs. Our lungs have duct, sac, our sac. In the sac, respiratory function happens, but sometimes due to infection, there is no respiratory process, because when extra fluid filled in the sacs, this is known as pneumonia. Okay, there are several bacteria which is caused by pneumonia. First, which known as staphylococcus, streptococcus, mycoplasma, klebsiella. Guys, the most common bacteria which is staphylococcus, about 95%. This bacteria goes into the alveolar sac and produce extra fluid, and there are several symptoms due to this pneumonia. One is sputum, breathlessness, you feel cough every time, you feel cough, fatigue. Pneumonia happens also due to virus. Which kind of virus? These viruses known as adenovirus, rhinovirus, varicella, coronavirus, influenza type A and B, type A and B, and also due to some fungus, pulmonary infection happens. These fungus known as candidiasis, another which is cryptococcosis. Don't be confused, I'm not perfect in diagram. Okay. Due to fungus, in fungal infection, they form carcinoma in the bronchi, and cancer happen. Another disease which is tuberculosis, which happens due to Mycobacterium tuberculosis bacteria. These bacteria destroy the cells in the lungs. Necrosis happens in the lower lobe of the lungs, and necrosis happens in the apex of the lungs. The lower lobe of the lung, which are present here, this is known as lower lobe of the lung. When necrosis happens in the lower lobe of the lung, this is known as primary tuberculosis. When necrosis happens in the apex of the lung, This is known as secondary tuberculosis. Secondary TB, primary TB. Guys, I think this overview enough for you. Take concept from my video. Thank you so much for your attention.